what would you say, is the most difficult type of wax to take out?
Oh man, I have an answer.
Because there's different types of wax.
Yeah.
And it's in different locations.
Yes. For me, I think the most difficult type of wax, when you look in an ear canal, it takes some practice, right?
Mm-hmm.
I remember the first time as a student, they had me look in an ear to see if I could see the eardrum. And I looked in through my little otoscope and I saw nothing. Like I remember looking at this black hole.
Thinking, I'm not good at this.
And then I looked up and the instructor was like, "Did you see the eardrum?" And I just lied. I was like, "Yeah."
That looks good. Looks
really
healthy.
good. I had no idea what I was looking at because it takes quite a bit of practice. But so when you get good at it and you look in an ear,
I love it.
you look in an ear, and if you see a wall of wax that is concave, meaning like it's bending backward
Towards the eardrum.
towards the eardrum, what that usually means is someone's been using Q-tips trying to get it out, and that Q-tip like creates this concave
cotton
and,
ear.
Yeah, and you look in there. That's often a really difficult one.
Yep. That's
Don't you think? I mean, what else?
Well, when I look in there and I see wax that's discolored, meaning normal wax is kind of an orangey, maybe a little bit of a hint of, I don't know, kind of a caramely looking color, right?
Yeah.
That's the normal color. But if you look in there and you see wax that's kind of dark, deep, like cafe red or like black,
It's old.
you're thinking, oh boy.
It's been in there
This
a while.
this one's going to take a little bit of TLC. This is going to take a little bit of time. And so some wax types are a little bit more difficult than others. We always love when the wax is just in the opening, it's easier to clean, but as you get beyond the second bend, becoming more proximal or very close to the eardrum, it is true that the further you get away from the cartilage, like the soft part of your ear, and you get into the ear canal 1 centimeter, and now all of a sudden you have another 1.5 centimeters left on this ear canal. The skin is actually now adhered to bone instead of cartilage. And I think the nerve endings, and some people don't seem to have any nerve endings, and they're like, oh, that feels good.
I kind of like the way it feels.
You're one of those
one of
people?
those. I like
I'm
it.
one of those that when people stick things in my ears, it makes my shoulders come off. I mean,
My mom used to do the bobby pin. She'd get the lamp out, and I
Which-
liked it. I was like, that feels good, Mom.
oh, wow.
Yeah.
Wow.
Good memories.
So, good memories. Not really recommending that one.
Don't do that, Mom.
So, but I will say where we're going with this is having
Where
an
are we going
expert.
with this?
Well, having an expert.
But we like taking wax out.
We do love taking wax out, and where I was going is with the ear canal becoming more and more sensitive the deeper the wax is accumulated. It really does take a professional, someone who's been in the ear canal a lot, to make sure you're safe, make sure that the earwax is going to be able to come out without it being way overly, damaging or hurtful or frustrating. And so it's a pretty sensitive and I think quite technical skill as far as taking wax out that is beyond the cartilage. It does take some know-how. I remember just learning to take wax out. I was very, very intimidated the first several years.
Oh yeah.
And then
in
as
school
you get
they scare you.
It scares, and then
They're
as
like,
you go,
don't hurt their eardrum.
yeah.
Go.
Yeah, well, yeah. So I mean, basically, as you get into this several years, and you see more and more wax types, and you see more and more different types of conditions where the wax might be, and how to tease it out without damaging or hurting the patient. It is kind of an art, and it's extremely technical, and so, yeah.
So how do we do it? There's 3 ways really. One way is we have gigantic medical grade syringes that we can fill with water.
Mm-hmm.
Sometimes we mix a little hydrogen peroxide in there.
Yep.
And you can squirt that in an ear and blast it out, irrigate it out.
Yep, irrigation.
And sometimes it's not even a medical grade syringe. Sometimes they have a little tube at
Little
a doctor's
bulb syringe.
Yeah, a little something that they can flush it out. And flushing it out's one way. That tends to be the hardest on people.
Yeah.
It's my least favorite way because you're going in blind, you're blasting it in, and it's not comfortable. Second way, we have little vacuums.
Yeah.
The vacuums are kind of fun. You can get in there, and now with the vacuum, we use surgical otoscopes, which means as we're looking in an ear, we can also watch what we're doing. And the little end of the vacuum can get in there, and if it's soft wax, you can just vacuum it out.
I love that.
But my favorite way, and I think probably your favorite way, is we just have tools. We have tools that look like a little mini crochet hook called a curette.
Yep.
We have little tweezers, but they're on the end of like little handle.
Almost looks like a little alligator coming out.
Alligator, yeah, he's fun.
It's kind of fun.
But you know, those little tools, also we use the surgical otoscopes, and you can watch what you're doing the whole time.
Right.
Definitely an art to that, but I think that's my favorite way to do it.
Yep. On occasion, if the wax is super hard, we'll just send them home with a softener and let them soften it, and then they come back a couple days later and we can suction it out. So
we've seen lots of weird things in ears, but mostly what we see is earwax.
Thank you for watching our video today. If you have any questions or if you'd like to reach out to us,
if you're interested in this, or maybe you have a loved one or someone you care about, probably needs some hearing help,
you can get a free consultation with either me or Dr. Lukenge.
you can call us anytime. Any of our doctors would love to return that call.
We'd love to talk with you over the phone or in person to answer any questions that you might have.